CTOs need to be looking ahead, really trying to think about the next generation of challenges.
Healthcare interoperability.
It provides more flexibility, it's easier to implement. We work with cloud destinations.
As you know, the entire world is crazy about AI.
Clients, it's really about delivering capability to patients everywhere. Unregulated adoption.
Peer-to-peer conversation, focus on real-world lessons.
Make the more I can be trusted if we put the right security infrastructure for the AI to interpret the data it's seeing.
Managing cost constraint in 2026.
That's really in working with cloud destinations. And we had designed, so we still have a lot of issues around data quality.
Actually works for healthcare system and payers.
Sort of transition from compliance spend to business transformation spend. And so doing that transition from Azure to AWS and being able to deliver the same capabilities when we're really trying to basically disrupt healthcare.
Welcome everyone, and thank you for joining us. 2025 has been a defining year for healthcare IT. Interoperability, automation, and cloud modernization have moved from long-term goals to near-term priorities for hospital leaders. Today's session is meant to be relaxed, peer-to-peer conversation, focused on real-world lessons, not technical theory or vendor pitches. I'm joined by Mark Scrimshire. I can say that he is a technical giant in interoperability from Onyx, who works closely with health systems and vendors across the interoperability ecosystem. Mark has a front row seat to how hospitals are navigating standards, workflow modernization, and the pressure shaping 2026 planning. Mark, it's great to have you with us. Thank you.
Great to be here. Thanks.
You're welcome. So let's quickly go ahead with the questionnaire. So of course, I don't want to be too formal though. Let's be kind of a casual where all of them can be part of it. I know that this is your forte and this is your quote. So ball is in your hand. I know that you will be going ahead like anything, then I have to catch up with you. So my first question to you is understanding the current, looking back in 2025, which interoperability trends or breakthrough had the biggest real world impact across healthcare system?
Wow, that's a big question. The big thing that's happening in the US is really CMS. And in 2025, it became clear that with the new administration, there was going to be no easing off on the push for interoperability. So CMS 0057, the prior authorization rule, which goes into effect in 340 days or so, on 1st of January 27, is really now coming to the fore. We've seen after a period of uncertainty for the first half of last year, plans, particularly because they're the ones really impacted, really waking up and saying, we have to do this. And then CMS with their health tech ecosystem have got multiple initiatives going on, like Kill the Clipboards, CMS aligned networks, AI innovations. There's a whole series of things happening around digital identity. It's really driving interoperability. It's driving that to really to get to the cloud, to get the scalability and get the flexibility to implement new capabilities. And that's what we've been busy at Onyx, really putting all of that in place. So we have all of our software ready for CMS 0057. But at the same time, I'm also involved on the standard setting area with HL7. And we've been taking feedback from the industry because we want to make sure that the requirements, the specifications are out there are actually workable. And so we've been taking feedback and we are actually still making changes. And there are still things that need to be resolved over the course of these 12 months if these interoperability APIs are really going to be able to scale to go across the industry. So that's really been the big thing that's been going on over the last 12 months.
Amazing. So I think the real breakthrough wasn't new technology. I think it's more interoperability finally working at the most important thing is taking the patient, is giving importance to the patient care. That's what my understanding is.
Yeah, you're right. Really, what started back in, really 15 years ago was allowing patients to get access to their data. And then what we've seen is sort of the healthcare side of things with with healthcare systems, providers and so forth being required to implement EMRs that had the capability to basically use standard APIs. And that really means HL7 FHIR, or Fast Healthcare Interoperability Resources. And that was working through various versions. And then CMS really got into the game with, we built CMS Blue Button 2, and that launched in 2018. And that really started to drive the payer side of healthcare in the US. CMS came out with regulations for the health plans to do the same that CMS had done in releasing data to patients. And that's driven an adoption of the basically the same standards across both sides of the industry. And so now that's really coming, it's accelerating. There's been a requirement to move to a new version of US Core, which is basically the FHIR version of the US Core data for interoperability. And now we've got both the EMRs and the health plans required to work off the same version of software, which really is just accelerating things.
Thank you so much, Mark. Thank you so much. As we're discussing about, as you're talking about FHIR, so I would like to know more about the FHIR and initiatives like TEFCA. Do you think it's actually influenced adoption and compliance in 2025?
Yeah, FHIR is definitely influencing what's happening in the industry. It has become clear from the moves from CMS, so the Center for Medicare and Medicaid Services, that FHIR is really the way forward. It provides more flexibility. It's easier to implement. It doesn't require signing up licenses to get access to specifications. So there's all of those benefits. At the same time, you've got HL7 with their fast accelerator that really emerged out of the ONC, or as it's now known, ASTP. And that is driving really how FHIR is going to be implemented at scale. So that's providing the framework for TEFCA, which is really the trust exchange framework with common agreement. So that has been adopted really by the provider side. Payers are still trying to work out whether they join TEFCA, but that's where some of the work that CMS has been doing in their health tech ecosystem around the CMS-aligned networks provides effectively an on-ramp for TEFCA-based technology to be implemented for the requirements that are really coming out in CMS 0057, the prior authorization rule that goes into effect in January next year.
Yes, perfect. Oh, that's great. So I do have another question, Mark. So where do you think what the hospitals are? Do you think the hospitals are struggling? Where are they struggling most when it comes to interoperability today?
Yeah, it's also, it's a national framework. So you join a QHIN, a Qualified Health Information Network, to get access to that network. You can make queries across the network. There's still things to iron out, but we're seeing some of the leading consumer applications in healthcare using TEFCA to be able to find out where your data is and be able to potentially retrieve it. I think some of the issues have been that each EMR, when it goes through an implementation, a hospital system can basically set up their own workflows that match what the way that they work. That can lead to data being put into different places in different data models in different EMRs. And now you've got those EMRs needing to present that data using a standard API, which is FHIR, HL7 FHIR. So we still have a lot of issues around data quality, but it's gradually, I think, sorting itself out. I think we will do things to improve that around the overall underlying data quality and the data being using the right code systems and so forth. I think what we'll also see is the ONC or ASTP as the sort of standard setting agency for health systems and EHRs is really shifting from certifying the EHR to actually certifying the APIs. So we should get more consistency around the way data is presented through those APIs.
Yes, perfect. Thank you so much. So I think as a CTO and the CIO, they should start focusing on that, yes, so they can map the 2026 journey accordingly. So based on that, I do have a question, Mark. So what interoperability priorities should CIOs and CTOs be thinking about as they build the 2026 roadmaps?
Well, let's go a little bit back in history to the original patient access rule in 2021, a long time ago now, 5 years ago. When that came out, it was as payers were implementing, and about 1,000 payers have needed, health plans have needed to implement. And when that happened, it was in some ways viewed as, I just need to publish data. I need an API that can push data out if payers are going to make that available to patients, to their members. And then what happened with the 0057 rule, when that was first published now, 2 years ago, what it really did is it started to indicate that the use of FHIR, these standardized APIs, was not just going to be a push the data out, but is going to increasingly be bidirectional and get close to being real-time exchange. Now, that's done, and so the lesson for CIOs and CTOs is sort of twofold. One is CMS has clearly indicated the future is FHIR, and they're going to use those FHIR specifications in more and more ways. So we're going to see potentially more regulation, but there's also going to be a lot of push for unregulated adoption. So CMS is trying to encourage the industry to adopt certain standards without laying down a law that says you need to implement these. And so for CIOs, CTOs, they really need to think about, have they got the right infrastructure in place to support the use of FHIR in this real-time bidirectional world that we're going into. The other thing that they really need to do is start thinking about the fact that there's going to be more data flowing in both directions. The CMS 0057 rule allows providers to ask about their patients from the payers that cover them. And payers, when members move from one plan to another, the member will be able to tell the new plan, go get my data and pull that data forward. When they do a prior authorization, if it comes in and they're asking for supporting documentation, that data needs to be stored and it needs to be made available to these APIs. So you're going to have vastly more data to work with. So when you're onboarding new members, if you have their history from their prior plan, you can work out what you want to do with them in terms of prevention programs and so forth. So what this means is CIOs and CTOs need to be looking ahead at how they can get more value from this compliance spend they've made that can now be used to help in business transformation. And we're definitely seeing that with prior authorization. Yes, it's going to be required for Medicare Advantage plans, but we've seen so many plans are saying, yes, I'm going to do it for my Medicare Advantage population, but I want to roll this out across my entire membership. So all of the commercial plans as well. So we're seeing that sort of transition from compliance spend to business transformation spend. And that's where CIOs and CTOs really need to be focusing on how they can get more value from this structured data that is going to be in their hands.
Well, that's amazing. That's really great. So, if I have to sum it up, please correct me. So, CIOs and CTOs should prioritize making interoperability reliable, secure, and embedded into everyday workflows. So, not just technically connected, isn't it?
Yeah, so it's really providing the ability to feed data in standardized formats to different systems. So if you're going out and buying a new platform, you should be making sure that those platforms have the ability to import and export data using FHIR so that you can more easily get data into the system and get data out.
Perfect. Thank you so much, Mark. Mark, related to that, as you know, that the entire world is crazy about AI. So I do have another question based on that as
Mm.
well. So how do you see AI-driven analytics and secure cloud platforms aligning with interoperability goals over the next year?
Really, the two things hand in hand. CMS in the health tech ecosystem have initiatives that are really driving the use of AI, right? So ultimately helping patients understand the conditions they have and the things that they need to do. So you've got that initiative. You've got HL7 is running various AI focused programs. So, how do you know when you start connecting two AIs together, the data that they're exchanging, where it came from, how you can put trust? We need to build trust into all of these exchanges, right? So AI is really leveraging interoperability. So some people are saying, why do I need interoperability if I've got AI? And in fact, the two work hand in hand. If you think about it, yes, an AI can go and receive, for example, a digitized fax, and they can run it through OCR and they can pull out context from that and convert and then make assessments based upon the data they're seeing. They have to effectively, if you see a fax and it's got a code on, how do you know which code it is, right? Because there are so many different code systems out there. What you have particularly with FHIR, is it's defined that will say, here's a code, and this is the code system it comes from. So in effect, the structured nature of a lot of the data exchanged using FHIR makes it more efficient for the AI to interpret the data it's seeing. So instead of having to go through that OCR and machine learning and all of those steps that we traditionally now call AI, it can actually be looking at structured data, in a basically typically JSON format that it can interpret with more confidence. And therefore that improves the efficiency and really the potential accuracy of those AI agents that people are implementing. And we're starting to see that just in the last couple of weeks. A couple of organizations have announced there's an integration with OpenAI and there's an integration with Anthropic or Claude that allows you to connect your health data to these AI models. And I had a fascinating stat just yesterday on a meeting I was in, where the OpenAI, in opening up this AI interface, had the number of inquiries, the queries that they had, the number of connections they had in one day. That number took a health plan, a health system, 2.5 years to get to with the traditional APIs and so forth that have been made available. So the demand is there. We just have to have confidence in the interactions, the privacy and everything that's wrapped around AI.
That's interesting. I was about to ask few examples. I'm so happy that you came up with the examples of the way the fax machine was, and so glad to know that. And I'm so happy to see that the excitement that you were showing, the way the AI also integrating with interoperability and make it enhancing
Yeah.
that feature. So thank you so much. Related to that as well, Mark. So what advice would you give to executives trying to modernize workflows while managing cost constraint in 2026?
Well, what we will see is more data, as I've said, flowing through the system. So how can you actually utilize that? Yes, you can start looking at, can I take AI to help do things like summarization of that data to really just help the decision makers make the decision with less time that they have to spend in research. Because if you take a prior auth, you can have a multi-page document that really sets out the policy guidelines. And what AI can do is relate the data that's been asked for with the relevant sections of that guideline, present the two, and enable someone to make a decision without hours of reading and evaluation. So it can accelerate there. One of the big things I've been working on here at Onyx, though, is really how do we now implement this interoperability at scale? And one of the big challenges is if we look back at 2021 and the implementation of patient access, and each of those consumer health apps that wanted to connect to a health plan's APIs or for a health system would have to go through a laborious process to get approved, and it was all manual. Well, if we're going to have 1,000 plans out there, potentially have to connect with the other 1,000 plans, then having that as a manual process is totally non-scalable. And so we have to work out a way to build trust in that. And that's one of the things I've been really focusing on here at Onyx, is how we can help leverage that. It's the big challenge to address. Plans are going to need to onboard thousands and thousands of providers to their prior auth APIs and their provider access APIs. And doing that manually is incredibly expensive, incredibly time consuming. And so what we want is to be able to build trust into the system. So how can a provider, for example, prove, yes, I am a provider and I'm agreeing to participate in this particular API exchange? Let's say it's prior authorization.
Yes.
A provider is typically connected in the US to 20 different payers. So they have to go through that process 20 times to get connected, which is why we have clearinghouses and so forth today. But how can we develop that so that they can, once they're connected to one, they can actually say, hey, look, I've already been connected to payer A. So should I go through less of a validation? And obviously the more connections I make, the more I can be trusted if we put the right security infrastructure around that in terms of validating actual organizations and the people that are acting on their behalf.
Perfect, thank you. So I really like the way you're using trust. I think that really would help us to reduce friction, duplication of data, rework, and will make the rework in the fastest and most sustainable way to control the cost. Yes. So I like the word whatever, irrespective of interoperability and AI driven. The trust, that is what matters a lot. So avoid
Absolutely.
the data. So that's really great, Mark. Thank you so much. So let's continue with another interesting question. I'm so really excited to know more about interoperability. My question is, what's one misconception about interoperability that leaders should leave behind as they scale efforts next year or in 2026?
What is a misconception? That's an interesting one. I think the key thing to date has been interoperability has been driven by the need to comply with regulation. Really, we need interoperability to improve the way that we can deliver healthcare in this country, right?
Yes.
And so that again goes back to my earlier point that now the executives in healthcare systems and health plans and vendors across the country really need to be looking at how they can leverage FHIR. And it's not about creating proprietary interfaces. Those days really should be gone, because every time you create a proprietary interface, you've got to have somebody create another at the other end, the ability to connect to it. And so that was really the challenge we had when we go back to like HL7v2, is that each individual connection had its own subtleties. And so it was, yes, it was a standard, but it wasn't really a standard, right? And so it wasn't easy to make the connections. What we need to do now is really work as a community and support these standards. And that's really been the difference with HL7 FHIR, is its strength is actually the community. You know, I'm going through this process at the moment where I'm authoring the Payer Data Exchange implementation guide that says how are payers and providers going to exchange data to meet the needs of the CMS 0057 rule next year. And we've actually had feedback from various payers and healthcare systems saying what we've got out there doesn't really fit. It's too heavily, too much of a heavy management overhead. And so we've rethought how that can be done, taking the building blocks we've already put in place and recommending a new set of workflows that much more closely match. And what we want to do is see that the industry goes out and adopts that, so that we make it easier for these connections to be made at scale. And that again comes back to the whole trust argument, and how do you automate the onboarding, the registration to actually use these APIs, because they're all secure. And because they're secure, you've got to prove that you are who you say you are to be able to use those APIs, to be given access. And again, that's the key, one of the key issues that we have to solve in the next 6 months.
I'm so happy for that you're really giving importance to it. I really like the word, again, as you said, to strengthen the community, irrespective of the technology, but towards it is more of strengthening the community. When you're talking about that, so yes, we are coming closer to home. Now that you have covered the industry landscape, Mark, I want to bring this closer to home. Onyx. Onyx has been navigating many of these challenges firsthand, and we had the opportunity to work together on modernization initiatives. So, before partnering with cloud destinations, what was the core interoperability challenge Onyx was trying to solve?
The core thing we were trying to solve is, we had been involved with CMS. I was the first person on CMS's Blue Button project.
Yes.
We implemented that for 53 million beneficiaries. So we understand scale. What we saw with CMS developing the regulation, the patient access API, is they were going to require a large number of payers and health plans and Medicaid agencies to implement the same type of capability. Well, when you're trying to do that at scale and hit a deadline for the industry, whereas many projects in businesses, you sort of set your deadlines, but when you've got the entire industry has to hit a particular date, how do you address that? You've got to think about scale and predictability and standardization. And so that's really, in working with cloud destinations, we didn't think about, we've got to just drop a FHIR server in. There's a lot of other pieces that are needed to make the solution work. And we had designed this platform that could handle data ingestion. It could handle serving up lots of data. It could provide connectivity to clients' identity services. It had a developer portal. All of that comes together. And what we needed to be able to do is to be able to implement that repeatedly. If in a single implementation, clients typically want their development platform, their testing platform, and their production platform, and you want it to be consistently deployed. So working with cloud destinations, you helped us with bringing in the ability to automate the CI/CD pipelines and create scripting that allows us to basically implement that entire platform without having to have administrators going in, tapping the keyboards to actually configure individual machines. It could all be automated. And that's really the power of the cloud, that you can take that capability and you can deploy it repeatedly. And that's what's allowed us, we're on target to have more than half of the Medicaid agencies in this country on our platform. And that's only possible. We've actually onboarded 19 of them in the last 8 months. It's only because we've got these automated processes to build a platform that's going to work predictably that we've been able to accomplish that rate of implementation. So that's been the key thing, is how we can build predictable processes that automate the deployment of these complex systems that have so many different interaction points.
Wow, amazing. I'm so happy that the partnership really helped you to scale up and to improve this business workflow. So glad to know that, Mark. Thank you so much. That's really interesting. Now, based on that, what was the most valuable outcome of the cloud destinations and FHIR work we did together? As you said right now, and
I
everything
think
else.
just being able to create our platform, each of the pieces that, as we're introducing new capabilities, we have to develop those pipelines, those scripts that do all of the automated deployment, that can provide the ability to configure, because we know, every payer, every client has some subtle changes, some differences. So it's about configuration and having flexibility in configuration, but having a predictable end result. And it's that combination. On the FHIR API side, we've taken all of our APIs where there are certifications, we've taken them through certifications. So anybody connecting into our platform knows it's going to work the same way across every single client. So that's a big, powerful advantage on the outbound side. On the inbound side, we've reverse engineered the implementation guides to make it easy for clients to provide us with data where we can do the magic of creating those FHIR records and being able to serve them up, and do that in a predictable manner. So we spend time in the onboarding of new clients to make sure that they're able to structure the data that they're going to send us. So we know that the data, if they're giving it to us, it's going to be able to get out through the APIs. So it's really driving those two sides of all of the predictable implementation, coupled with the fact that we're doing certification of our outward-facing APIs, bring a solution that is really pretty rapidly implemented for clients, and implemented with a lot of capabilities that a custom implementation really can't do. And the other thing that Cloud Destinations helped us with is actually we started out co-developing our platform with Microsoft, but we've now taken it to become multi-cloud. And so doing that transition from Azure to AWS and being able to deliver the same capabilities was really critically important. So, we have that predictable solution across multiple clouds available to our clients.
Amazing. Thank you so much. I'm glad to know that we really, Cloud Destination, helped you to make it cloud enabled, standard based interoperability, turns integration from a bottleneck into a strategic capability. So I'm so happy to know that, Mark. Thank you so much. Related to that itself, how did Cloud Destinations team improve integration speed, reliability, or pair onboarding for Onyx? I
Well,
know you
so it
partially
all goes
answered
back.
this, but yes.
It all goes back to those CI/CD pipelines where we have configuration documents that
Yes.
drive how the implementation actually happens. So we have the capability to either implement in a cloud that we manage for clients, which really fits smaller health plans where they don't have the technical capability. But we can also take those same scripts and we can deploy into more larger, sophisticated clients where they want to run it in their own cloud. So we have all of that capability, and that's really been the result of the partnership together to build this predictable deployment model that allows rapid deployment. We can take a health plan for the patient access APIs live in really less than 3 months from start to finish. And when you're thinking about that, that includes loading like 7 or 8 years of history about the members and implementing both a test platform and a production platform. I think that's pretty impressive.
Oh wow, that's great, and thank you so much. It's great. I'm feeling so proud of you to be an employee of Cloud Destinations. I'm so happy that we're really helping you to scale up the business, the standardization and automation at the cloud and integration layer. So that's really good to know that the way interoperability is scaling up. Thank you so much. So it's as an employee, I'm really proud of what we are doing. Another question, I'm not taking too much of time, Mark. Can you share a concrete example where automation led to real results, such as reduced billing errors or faster onboarding, as you rightly said right now? But yeah, can you share us more examples as well?
Yeah, I think the simple example is faster onboarding, right? And that even applies internally. We work with cloud destinations where you're providing support for us. So just being able to bring on new employees as we grow and make
Yes.
sure that that they've got their machines, they've got their accounts, they're connected into our internal systems quickly and seamlessly, so they're basically productive from day one. That makes a big difference to us internally. And then, really just the fact that we've now invested something like 7, 8 years worth of development time into our platform, in basically building all of this predictable automation that still provides the ability to customize to meet individual client needs, but staying within the overall FHIR standards that are needed to make interoperability work. And so,
Yes.
it really provides that basic platform, and those the lessons we learned from going through that process. It's never painless. But it gives you valuable lessons, and that's where we take our expertise back to the industry. That's why we contribute to HL7, where we're involved in authoring implementation guides and really trying to think about the next generation of challenges that our clients are going to have to go through if we're really going to make interoperability work. And so that's where we're really trying to help drive the industry along, and not just delivering product to clients. It's really about delivering capability to patients everywhere.
Absolutely correct. Thank you so much. So I do have one more question to go. That's it. I do understand I'm sitting here though. So, yes, last question. If you had to describe cloud destinations as a partner in one sentence, how would you say it, Mark?
I think you're just a true partner.
Wow.
Every organization can go through tough times where you're trying to save money, you're trying to implement new capabilities, and we do some things that you think are impossible, and it's only because we've actually got a true partner that works with us that we're able to actually accomplish some of the crazy goals that we have when we're really trying to basically disrupt healthcare.
Mark, thank you so much for sharing this valuable insight. So now I know we are so proud that Cloud Destination is a partner that